Good afternoon, everyone. This is Mark Skidmore. I'm giving this webinar on behalf of the North Central Regional Center for Rural Development. I'd like to welcome everyone. Today's webinar is Capacity Building for Improved Behavioral Health in Rural America, Prospering in a COVID Context. And the webinar is sponsored as part of a larger SAMHSA-funded project led by Purdue University. And the webinar series is Combating Opioids. And so this is actually the last of the series, so we're coming to a conclusion here. We're really glad that you're able to join us. I want to introduce our speakers today. Richard Spoth, Greg Pleer, Cassandra Knutson are all from Iowa State University. They all are a part of the Partnerships in Prevention Science Institute, and all three are working together to help develop the National Behavioral Health Extension Network, which is a capacity building effort within Extension to help build capacity in the behavioral health arena. Richard Spoth is the director of the institute, and also Wendell Miller, specialist in prevention scientist. Greg Pleer is a program manager, and Cassandra Knutson is a program specialist. So they're all working together, and they're all going to share in the presentation. I'd like to remind all of you that if you have a question or a comment, you can type it into the chat, and then the speakers can address those along the way or at the end. And so with that, I'd like to pass the baton on to the speakers. And thanks again, Richard, Greg, and Cassandra for being here today.
Good afternoon, everyone. Thank you for the introductions, Mark. Thank you to our host for this webinar series. And we appreciate everyone for taking time out of your busy schedules to be with us for this webinar. The three of us, Greg, Cassandra, and I, will be kind of a tag team to present the webinar. And I wanted to start by letting you know that it is being recorded, and it will be available on the North Central Rural Development Center website. So speaking of thank yous, we have an awful lot of funders, collaborators, and contributors to thank. It feels a bit like trying to appropriately acknowledge all the well-deserved work of a lot of people in a short span of time, like you might confront at an award ceremony. So suffice it to say, we wanted to put the acknowledgments on the slide, which will be available, and underscore the point that we truly are very grateful for all the funding and collaboration and participation and contribution we've had from all of these folks over these many years. So I'll give you a brief overview of the topics that we plan to cover, first of which is the challenge we're confronting with rural America's substance and opioid misuse issues, along with all the associated problems, particularly in the wake of COVID-19. We will be talking after covering that topic about how at least there are some good approaches to addressing those challenges at the program level. And we'll be providing a couple of illustrations from our own work, namely Prospering Step by Step, State by State, and WeCanPROSPER. We'll also be covering after that, and in connection with that, what might be done at the organizational level, focusing on as Mark mentioned, system capacity building and networking to address these issues. I'd like to begin by placing this in perspective. We're talking about the opioid crisis in general. And it brings to mind a talk that I was asked to give a couple of years ago, where the subtitle of the conference was When It Hits Home. At that time already, the opioid overdose death rates exceeded the annual rates of motor vehicle deaths. At that time, half of all rural adults were adversely affected by the crisis. And everyone was hearing a lot about those statistics that show just how much of a crisis it was becoming. Thinking about when it hits home, for me and other colleagues, that's about coupling those statistics, which are staggering in some sense, with the stories of individuals and families and communities that are adversely affected by the crisis, and especially now in the COVID context. So here we have a picture of Sandy Eberlin. Was a perfect illustration of just how devastating this was a while back. And she's representing pictures of her family and her son, Michael. Michael had been through treatment 19 times. He had lost 13 friends before he died himself. And Sandy vowed to do something to address the issue. But her story, as briefly mentioned here, couples with countless thousands of stories like hers that compel us to action, I think, when you think about how many people are being affected, and again, how that's happening in the wake of this opioid crisis. So as this crisis is unfolding, we're seeing two kinds of effects when it comes to substance misuse. We're seeing effects across substances, and we're seeing effects across populations. So this represents some data from a Research Triangle Institute study that was a web-based survey in May. And it's just one illustration. There have been many studies by this time that shows that there was a significant increase in alcohol consumption over that 2-month period, February through April. Notably, there was a 5% increase in binge drinking over that time. Looking at overdosing over the last few months, we have here the detection mapping application program results. And basically, it's a program to track patterns in overdosing across the country. After March 19th of this year, there was a 61%, almost 62% increase in overdosing in participating counties. And that's what basically the take-home point from the slide is how that was happening. And that, of course, March 19th represents a time when we were having increasing social distancing and stay-at-home orders happening when this was occurring. Now, this program has software to detect geographic case patterns over time, just looking at different clusters of overdosing and where they're happening. And these analyses show how there's been a shift in these patterns, and notably there's been a shift from urban areas to surrounding suburban and rural areas. So in the wake of COVID-19, we're seeing these changes that kind of combine to intensify what some have characterized as a brewing rural, a perfect storm in rural areas. And specifically, Ron Madderscheid has talked about over the last 3 years how opioids especially, but other drug problems are escalating in rural areas. And as I mentioned before, this American Farm Federation Bureau survey suggested that half of adults were adversely affected. that is coupled with sparse services and increasing needs. And in his work, he highlights how that's happening in about 85% of rural counties. And again, in this current context, it's just getting intensified. The combination of factors that are contributing to these huge problems are getting worse. So what do we do? I guess to highlight one of the points is this is a lot about prevention and prevention services. And our work is always focused on rural areas, not exclusively, but primarily. And that's one of the things that has always been there that we've tried to address, that there's just limited access to prevention services, especially in some rural areas. And especially the kind of prevention services that we'll be talking about in a minute. And when it comes to those that target opioids specifically, those that are proven to work with opioids, they're even more sparse. So what can we do? And one of the points made by Ron in his writings, and one of the points made elsewhere in the literature is about taking advantage of the existing infrastructures that are there in rural counties to one degree or another. So of course, extension is in nearly all counties. Public school systems are in all counties. Public health services are in all counties. And the general idea is to build through these infrastructures to strengthen what can be done by way of prevention of opioid and substance misuse issues, along with associated problems like depression, anxiety, and so forth. And this can be done, one way of approaching this is through the 4 practices that are represented on the slides, by forming partnerships with community teams, as county extension does so well, including specifically public schools, public health, and other community partners, using quality, sustained, evidence-based programs that are designed for all youth and families. I'll talk about that more in a minute, and creating an extension-based system of support, basically. And something like that, it's been heartening to see as in our state and other states where extension is mobilizing to provide supports of the full range of resources that people could use in this COVID context. And then expanding extension-connected networks. So there's a sort of a nutshell version of the problems that are happening in especially in rural areas and especially in the wake of COVID. And so what we'll be talking about for the rest of this webinar is how, some ways, not always, but some ways, some strategies for addressing the challenges that this presents to us. Start focusing on programming and illustrating that with a couple of the programs that we are offering through our work at Iowa State University in collaboration with lots of other people in lots of other states. So to unpack this a little bit, one of the most authoritative sources for what's happening in America when it comes to addictions and what to do about them is a Surgeon General report that came out in 2016. I had some colleagues that were working on that and pulled a couple of quotes about its emphasis on how critically important it is to use prevention and intervene early in the process of becoming addicted, and then to take advantage of the effective programs and policies that already exist that by the view represented in the Surgeon General's report could reduce substance misuse and related threats and problems. So this is especially, I think, a call to action for extension. We've done three reviews of the literature on doing prevention programming and extension, and this is this is one source, Hamilton colleagues, and it speaks, I think, eloquently to the point about Extension's mission and how it serves a purpose of getting beyond the academic community, getting the benefits of the science and the research into the hands of the policymakers and general public that can use it. And then sort of fast forwarding in time, just recently, the Office of National Drug Control Policy issued a Rural Community Action Guide, which directly notes how key Extension system is in helping deliver prevention models for rural communities. They do specifically note, one of the illustrations we'll present, namely PROSPER, and call it an evidence-based prevention strategy that works, and reference it as an innovative prevention delivery system for evidence-based programs. And building on that point, I'll say a bit about what PROSPER is. Later, in the next segment, Cassandra will be presenting PROSPER in more detail, kind of the essentials of PROSPER. But I'll make 4 points about it. It's evolved through over 25 years of research, starting with NIH-funded controlled studies. That work, every bit of it, all the large trials that we've conducted have been in cooperation with Cooperative Extension. Basically, we learned from the work, and every time we would do another study, we'd try to apply it. That led to PROSPER. In a few words, it's a proven state-based, science-driven system, and at the heart of it is what's highlighted in green. It's a training, technical assistance program delivery system designed to support sustained, high-quality implementation of universal, that is to say, for everyone in the community, evidence-based prevention programs. But of course, as is the case with anything that works, especially at a systems level, it takes a bit of effort to make it work well. So it does take, and we'll be getting back to this point, some careful consideration and buy-in and readiness to apply it. But from the get-go, one of the things we've been interested in is how helpful universal interventions can be for general populations of rural communities. And this says a little bit about why we have been from the beginning, in addition to working with Extension, which works with general populations, interested in these programs. And first, they address specific research-based risk and protective factors that are common to many types of substance misuse. And our findings show that when you address one, you typically address many others. They're strength-based. They focused on, for example, protective factors in families. They focus on skills and competencies in students, and then work to enhance them in a way that reduces likelihood of substance misuse. And interestingly, there's a lot of evidence of crossover effects. So when you do this well in addressing substance misuse, you can help a lot of other outcomes, including academic success, health risk and sexual behaviors, problems that aren't explicitly addressed in the programs, but are affected by the same risk and protective factors. And also notably, unlike what a lot of people thought, especially 20 years ago or so, when you do this well, you benefit high risk at least as much or more high risk youth and families. So I'll turn to the why in terms of outcomes that highlight why it might be worth considering doing these kinds of programs. And to start with, I would mention that in our programming, we expect to see the substance misuse outcomes longer term, but first we expect to see outcomes that concern benefits to families and students. And this slide highlights the kinds of outcomes that we have seen improve parenting practices, parent-child interactions, and family cohesion. So essentially, we have kind of a intervention theory or logic model that suggests that if you address these kinds of outcomes that kind of map onto risk and protective factors, it's reasonable to expect that longer term you'll see reductions in substance misuse. And this kind of highlights, so papers report results showing over a long run that kids who participated are better at problem solving. Notably, social network analyses that we've done show how kids in schools that have PROSPER are less influenced by those in their peer group, in their social peer group, who have begun using substances early. That's a key finding of relevance. But one of the reasons PROSPER has been cited, for example, in this Rural Community Action Guide, concerns opioid-specific outcomes. And so this represents long-term young adult outcomes concerning prescription drug misuse. And to the right, you see the take-home points. PROSPER and control differences are both statistically and practically significant. We have a way of measuring that with relative reduction rates. And in practical terms, for every 100 young adult misusers in non-PROSPER communities, there would be about 20 to 26 fewer if all of this held and it were implemented well. Again, another couple key points are illustrated by this slide. First of all, what PROSPER does is implement programs that address risk and protective factors in the two primary social environments, both family and school. And the importance of doing that was illustrated in earlier studies, such as the one that produced the findings that you're seeing here. If you look at that green oval, what that represents is a higher risk subsample in the PROSPER group, and that compares with the level of use, which is much higher in the control group. So if you just look at the higher risk kids, you see that they're benefiting more in this particular case than the other kids in general or lower risk kids. Also, finally, by way of kind of talking about why does it make sense to at least consider this, we've done a number of economic analyses across several different studies and show good returns on the investment. This particular slide highlights from the family program alone, it would be reasonable to expect a $9.60 return on every dollar, and that's just concerning the reduction in alcohol disorder outcomes. For PROSPER, what we've done is done extensive cost tracking so that we could do cost effectiveness analyses, and this is what it looks like with prescription drug misuse. And don't worry about all this information in the slide, except that it is pretty costly when kids use, and that's one of the things we showed. It does vary in terms of the cost effectiveness, what kind of combination of school and family programs, but the main take home is in that bottom bullet. There should be at least $4,000+ in cost savings to society per case prevented. So what does all this suggest? Two main things, or three. Two main things that sum to the final point before we turn it over to telling you more about PROSPER, and that is that we're talking about extension-assisted real-world implementations of these programs using a system that was developed over the course of many years of study, and that it could be a key strategy in achieving public health impact. The thing that has to happen to a greater degree for that to occur is that we need to scale it up. It needs to be used in more places by more people, and potentially benefit more populations. And with that, I'm going to turn it over to Cassandra, to talk more specifically about our current program. So thank you.
Thanks, Dick. So yeah, if we go ahead and dive right into our first illustration on addressing the challenge at the program level. You heard a little bit about our PROSPER work and associated PROSPER research outcomes. Our first illustration is reflected of our prospering step-by-step, state-by-state, or P2S work. So what P2S is it's a framework for scaling up an updated and enhanced PROSPER partnership model, or PROSPER second edition. P2S applies the same 5 core components of the previously tested and proven PROSPER partnership model, which we'll get into a little bit more here in our next slide. But the overall purpose of P2S is to build capacity within university extension systems in order to support a multi-state scale-up as well as expansion of PROSPER locations or sites within those states. So therefore, the updated and enhanced model itself also includes newly updated curriculum manuals, trainings, technical assistance, and supporting materials and resources for local team use, all of which are designed to support sustainability and scale-up initiatives at the state and local level. So taking a look, as mentioned, there are 5 core components of the proven effective PROSPER model. Each of these core components here are based on implementation science principles, and when used together, they create the formula for sustained high-quality implementation of the best prevention programs available for youth and families. So if we kind of explore each one of these, at the top in green, we have core component 1. And this is a 3-tiered state-level partnership that is based in the university extension system that includes a state-level management and oversight team, a team of technical assistance providers, and then local-level teams that work to implement prevention programs and strategies in a county or a community. Next, in light blue right underneath, is small strategic teams. So these local PROSPER teams are led by a county extension leader and include community representatives from schools, behavioral or public health agencies, parents and youth, and any other volunteer or stakeholder groups in the community. These teams of approximately 8 to 10 members work closely together with schools to support the positive development of youth and their families, and then they make sure that local prevention programming efforts are sustained over time, as well as consistently delivered with quality and fidelity. Core component 3, here in the middle, has to do with the actual evidence or research-based programs and strategies that local teams work to implement. Teams work to deliver one school-based program, which is Botvin's life skills training program, that is delivered in either 6th or 7th grade. They also work to deliver one family-focused program, which is the Strengthening Families program for parents and youth 10 to 14. This program is offered to 6th grade students and their families, and this occurs outside of the regular school day. Core component 3 also includes activities such as raising awareness of substance misuse issues in the community, and creating educational events to promote prevention programs and strategies. If we move on to the next, what makes PROSPER different from many other programming efforts is the emphasis it places on local teams moving through a series of developmental phases. And that's what core component 4 highlights, a developmental process that follows a series of standardized benchmarks of progress or achievement. These 4 distinct phases include first, organizing the local team, initial operations and ongoing team operations, and finally, long-term sustainability efforts. The state management team monitors local team progress to ensure that goals are being met and that all teams are working together to effectively deliver programs and strategies year after year. And finally, at the bottom in dark blue, The only way to know whether the PROSPER partnership model is truly making a difference for youth, families, schools, and communities is to carefully and systematically evaluate its impact. That's why developers of the PROSPER partnership model have included a range of process and outcome evaluation activities as an actual core component of the model. The data collected is used to make needed changes and improvements at the local level, thus creating a continuous feedback loop of information and an optimal way to tailor technical assistance needs. So if we review the first core component of the PROSPER model in a bit more detail, we can see the three-tiered infrastructure as depicted here in the figure. The area within the large blue box around the outside defines a PROSPER state partnership. So in other words, all the PROSPER teams in a state, as well as their TA providers and the leadership at the state level, fit inside the box. From there, a PROSPER state partnership consists of those three tiers. Local teams at the top box are based in an individual county or community, and again, they are responsible for implementing prevention programming at the local level. Then in the middle box, we have our technical assistance providers. These serve as the link or liaison between the local teams and the university extension system. They work to provide tailored, ongoing, proactive technical assistance to the local teams. Finally, at the bottom, we have our state management team. The state management team oversees all the work that is conducted within the state. They provide guidance, oversight, and support. All three tiers are connected with arrows here in the figure. These are communication links. So the solid arrows between the tiers indicate direct lines of communication that occur regularly and are used to provide two-way feedback and technical assistance between teams and their TA providers and TA providers and the state management team. The longer dotted arrows on the sides indicate additional communication links where PROSPER state and local level staff may have less planned communication, but are still directly connected to teams to ensure successful outcomes. So all PROSPER state partnerships combine to become the national network of PROSPER state partnerships, which is currently made up of 14 states. Support to all these states are provided through our PROSPER network organization team housed at Iowa State University. So our team is made up of trainers, training developers, technical assistance providers, evaluation specialists, and research and prevention scientists. You can see here, this kind of helps us visualize the PROSPER network organization and how state partnerships are connected to the larger network here. But again, as depicted, there are 3 state partnerships here, each with their individual 3-tiered model. They're connected to the network organization in several different ways. So for example, typically a state partnership will have a state management team member called a state coordinator. They are directly connected to the PROSPER network state coach who provides ongoing tailored technical assistance and support. A second example is that a state management team will also include a state evaluator, and that state evaluator is connected directly to the PROSPER network evaluator, who again provides ongoing tailored evaluation services. So being connected to the PROSPER national network means that all state partnerships receive comprehensive implementation support tailored to meet the individual state needs through the PROSPER network organization team. In order to receive support, an agreement between the state partnership university and the P&O is required. Specific support services delivered by our network team includes all of these items, but it certainly is not limited to this. So for example, State partnerships receive a complete package of implementation materials and curriculum manuals. They receive tailored ongoing training and TA for both field operations and evaluation activities. They gain access to web-based applications and resources. And then also they have access and use of the PROSPER brand and associated branding materials. In terms of funding strategies to support P2S scale-up work, there are several options that our network team can also assist potential state partnerships with. So for example, we have here a couple different grants listed, but grants may help cover personnel and programming startup costs. And the examples here are the SIFAR and the NIFA RHSE, or Rural Health and Safety Education grants. Other ways to support costs can include making sure that PROSPER affiliated roles are included in an extension personnel's plan of work or contributing to a portion of their FTE. And then finally, it's also worth mentioning that a large part of what fosters sustainability at the local level for PROSPER teams is actually working on their own to secure resources to continue programming efforts. But certainly, internal and external funding can also support those efforts, especially when teams are just starting out. So with that, I will hand it over to Greg for our second illustration.
All right, thank you, Cassandra. So we're talking about addressing the challenges at the program level, and for the second program, we're talking about WeCanPROSPER resilience training. This has obviously not been around as long as PROSPER. Dick talked about the 25 years plus of research behind PROSPER. WeCanPROSPER is really responding to a more immediate and recent need that we'll discuss. So right now we'll cover WeCanPROSPER resilience training, some of the background and the why, and then give you a brief overview of the actual training. I think I'm actually going to skip a slide there and go back because I want to start here with the, this may be a survey that you're familiar with. So 4-H did a survey just this past, I believe it was in May. It ran about 1,500 youth ages 13 to 19, and it explored the role of resilience in mental health, along with gathering youth perspectives on mental health issues in their community, basically asking them how they felt about what was going on related to COVID, how it was affecting their mental health and those around them. And what they found was really interesting and honestly a bit scary. These found that 55% of those youth said that they were experiencing some signs of anxiety. 45% were experiencing excessive stress, and 43% reported experiencing depression. So with all of this, that came down to about 7 in 10 of those teens responding to that survey said that in one way or another that they were struggling with their mental health. And now this last bit isn't on the slide, but also what it came down to, and if you looked at the survey, you might remember, is that one of the factors that was really important is that most of these youth believe that this was going to have a lasting impact on youth mental health, which is really, you know, a scary thing. And thinking about that, as we go to our next slide, there's a study completed by the Wellbeing Trust that estimated between 27,000 and 154,000 additional deaths of despair over the next decade, just as a result of unemployment from COVID-19. So we think about all those people, you know, during the initial lockdowns and things that lost their jobs, you know, the different industries you can think that were really impacted by that. So they look back at, and historically, when there is a % rise or a 2% rise in unemployment, how does that affect, what's the resulting changes in suicide rates? And they use that to figure out that there's going to be tens of thousands of additional deaths likely just from the impact from loss of jobs just in this year. And to think about that, that does not even include when you think about the other mental health impacts that result from this pandemic. When you think about, you know, the loneliness, you know, the fact that people don't have as much access to behavioral health care, due to whatever different reasons, whether it's the isolation or the fear of actually going out and getting services. So um, there's a resulting need. COVID-19 opens up the door to offer a new vision for the future of healthcare in this country. Mental health should be central to that vision. When we think about this, we've already talked about the opioid epidemic. Now we have the COVID-19 pandemic, and we have a third epidemic on its way, and that's a behavioral health epidemic as a result of the COVID-19 and the current situation that we're in. So as a result, what we did over the past, really since the beginning, and as we started to recognize the issues related to COVID and what was going to result of that, we started thinking of what can we do to help. And what we came up with as part of this, just one program, is the WeCanPROSPER resiliency training. This is a virtual training and technical assistance system, not just a training, but it's actual system built around the training to address COVID-related school and community needs for resilient responses. And we did add COVID in there because it is the current issue, but this will long outreach the current COVID pandemic. And like Prosper, this is grounded in a long tradition of cognitive behavioral health and stress management science and resilience intervention science. So in the same philosophy of Prosper, we want everything to be absolutely grounded in the best evidence that it possibly can. And lastly, to implement this with high levels of fidelity and sustainability, and to make this really easy to use and effective in the communities, we use Prosper implementation research and a system to back this up so that the end user, those in the field, can really use this system effectively. So this is really, WeCanPROSPER resilience training is really a four-phase process. And the first is a Resilience 101 basic training. Next is local training of trainers, then a community-based resilience training teams, and then resilience training team network and partnership development. So you can see how it expands out from an initial training to the whole community or the whole system within the community, helping to develop community resilience. And I'll just give you a little bit about the Resilience 101 basic training. It really has three basic components. And the first component of that is experiencing, recognizing, and strengthening personal resilience. It instructs on what resilience is, and it helps participants to identify their own personal resilience needs. This training, again, it's online, it's virtual. It's several hour training. So obviously during this training, there won't be, somebody won't come out of here a resilience expert. So we wanted to give them the skills to build on their own resilience and to build on their own resilience needs, and also to be able to spread that among the community. So the second part of that is identifying appropriate resilience resources. And that's part of the bigger system, is that we are doing resource scans for the best resources out there to support those people that are taking the training. And in turn, they know where to identify those resources and how to choose from those resources. And lastly, the third step of that training is the planning to address the resilience issues. So they identify where they may have resilience weaknesses or resilience needs. And as a result, they can plan their own resilience building through the resources that they have. Next, for communities that are interested, we then train their trainers. So those folks that have been through the training have the opportunity to become trainers. So they aren't reliant necessarily on others to provide that training, and can provide that training themselves with the assistance of others. And then they can build their own community resilience training teams. All right. So they can actually turn those into teams and help the community build resilience, and potentially expand beyond that with RT resilience training team networks and partnerships development. So developing partners around the community to share resource and to build further resilience within their communities. So that was just a brief overview of WeCanPROSPER resilience training, and feel free to ask any questions, or we'll have time in the end to ask questions. So lastly, in the home stretch now, we're going to cover addressing the challenge at the organizational level, how to build systems capacity and network, at the local organization level, at the state level, and also at the national level. Prosper over the past 25 years, there's a lot of lessons learned, and we want to expand on those lessons learned from Prosper to help support states and communities really be able to develop their own systems and partnerships with other states to be able to address behavioral health and substance misuse issues, opioid issues more effectively. So addressing the challenge at organizational level, the stage is set for an expanded role of extension to enhance evidence-based behavioral health programming and program effectiveness evaluation that has evolved over the past 3 decades. So I talked about Prosper and what we've learned there. And extension is really in a position to continue to build on that. And when we look at the conceptual framework that we've designed, this is really built as a result of a 2018 survey of extension on the status of substance misuse prevention and behavioral health. And on the survey, it asked respondents, should extension be playing a role in reducing opioid use as a behavioral health issue? And over 2/3 of the respondents said yes. But in the same survey, only 5% of those actually stated that they strongly agreed that the extension system had the capacity to address the behavioral health issue. So we have a real need or a real gap there. We say we should be addressing something, but we're saying that we don't have the capacity. So this framework is a result of that. And we could spend a whole hour actually on the framework, but we're going to cover just one section of that very briefly. But there's really 4 core components of building capacity. There's organizational development, which is what we're going to focus on here in a little bit, but professional development, giving people the skills to do the job, enabling them to do the job, the financial and resource development behind that. And then the culture of behavioral health, believing at all levels in our system that it is a role we should be providing, right? And then sharing a common language and a shared behavioral health views and values. All right, so what we're going to focus on is primarily the organizational development arm of this, and just on one core component. You've heard briefly mentioned the National Behavioral Health Network, and that's the last, as we wrap this up, that's the last thing we're going to talk about. And that's really the networking infrastructure that really sits at the base of this and really provides the structure at the local, state, and national level, and the ability for us to address behavioral health and opioid issues across our country. So what does that look like? We developed the Behavioral Health Network really to improve community prosperity and quality of life by increasing access to science-based partnerships, programs, and other resources designed to enhance youth and family behavioral health and to prevent substance misuse. So really, we're trying to make those connections that already exist, at the university and community level through extension. We're taking what extension already does well into the behavioral health and substance misuse arena. So really, there's some goals and expected impacts, and we have a great logic model that we started off with, and I'd love to share it, but again, it would be a whole hour presentation. So this is just wrapped up what the primary goals and impacts of that model are. And there's really 2 functions of our behavioral health network. And the first is to improve states' access to research and evidence-based behavioral health resources. Something that has been so critical to Prosper's success is making sure that the boots on the ground, the programs that they're implementing have been proven effective. And that's exactly what we're doing, is providing those resources to the boots on the ground so that they can choose and use the best resources out there. And secondly, it's to network state partnerships designed to increase capacity responding to issues. Every state's unique. A lot of these states have similar issues though. Okay, to be able to share that information, share best practices is so critical so that we aren't reinventing the wheel. One of the things we learned right off the bat as we started getting into this pandemic and we were even building our own behavioral health resources is how much there were redundant production of products that were out there. Part of what we're doing is to not recreate the wheel, but to share best practices and to get that information out there so there isn't the redundancy. And so those best practices are getting to where they need to be as quickly as possible. And as a result, we should have a reduction of substance misuse, promotion of increased resilience and well-being in rural communities, and reduction of behavioral health issues, depression, anxiety, conduct problems. So, and also, as Dick mentioned towards the beginning of this, we're primarily focusing, obviously, with this on the rural communities. I haven't mentioned that much, but so this is a focus where Extension does their best work, and that's in the rural community. So in accomplishing our goals, we are mid-process in doing this. So first, we worked on building a PPSI hub and field capacity. So growing from a seed level funding, increasing small time allocations for key personnel. Right now, I operate as the ENET manager. We have some additional supports, but our supports are small. So like everything else, it requires resources, and the two ways to do that are to network and gather partners and gain partners, and then also to identify and resource funding. We've compiled and coordinated dissemination of online resources. We've been doing exhaustive research with our team, finding the best research and evidence-based resources related to resilience and related to best practices. And that'll end up being a clearinghouse that'll be available to others. To support state partnerships through training and TA, we've been busy networking, identifying those state partners that are critical to the success of this. And lastly, to support behavioral health partnership specialists through additional training resources. We are supporting those in the field, and we've started gaining some of those partners and helping those partners with their work that they're doing in the field related to behavioral health. So I think with that, and actually just really quickly, because I'm running a little bit over my time, as you may recognize this also, it looks very similar to the PROSPER model that we showed you, that Cassandra showed you earlier. But if we look at that, just right here, you see the same three-tiered approach that we took earlier with PROSPER. We had the ISU Network Hub and all of their partners supporting state behavioral health partner or teams, coordinating units. Those folks are supporting their specialist training and TA teams at the next tier. And then lastly, those training and TA teams are supporting the communities in their resilience and their substance misuse prevention efforts. So with that, I'm going to turn it back over to Dick for some summary and conclusions.
So thanks, Cassandra and Greg. Essentially what I'm going to do is just do a quick recap of essentially what we've been saying over the last hour, and maybe connect a couple of dots going full circle to where we started with Mark's introduction. So 4 summary points, basically, and that is in the wake of COVID-19, we have this perfect storm brewing, basically an intensified perfect storm that began since way before COVID-19 and was exacerbated by the opioid crisis. And it calls for innovative solutions. And we don't have a corner on the market on that, but we have some ideas, such as were represented here, based on some literature we reviewed and Surgeon General recommendations and so forth. And what that comes down to, as you remember from the quotes from the Surgeon General report, that this could benefit from broader dissemination of evidence-based programs. It's a challenging enterprise for sure, but there's plenty of evidence that that can be helpful. That dissemination could be enhanced through organizational level changes, such as what Greg has just been representing and talking about. But that will require, in that 4th point, some capacity building, some careful thought and strategies about how to best do that. I'll bring that last point back around to something Greg mentioned to put this in context, and that comes back to Mark's introduction. Greg, as you heard, referenced a survey that was done all extension systems in the country. That was performed by a group, an extension opioid crisis response work group. Mark took the lead on that, and the charge was to come up with some recommendations for what extension could do. The National Behavioral Health Extension Network was one of the key, connects to one of the key recommendations from that report. That effort started way back in early 2018 and led to eventually what Greg was describing, that is very much in its formative stage of development. I'm guessing you might have gleaned that from the slides. But it's, we're very grateful, going back to that acknowledgement slides, for the support for doing it. But it's in its formative stages, as is some of the other more recent efforts in the COVID-19 context, including the WeCanPROSPER effort. But all of it comes back to a vision, which is represented in the next slide, for having this kind of effect, which is pictorially represented. Science with practice, capacity building for doing that, and basically what we believe is harnessing that power that extension has for specifically behavioral health impacts. So we have, as I mentioned in the beginning, this has been recorded. It'll be available. Please feel free to let us know at whatever. We have a few minutes for, I guess, very few, but we have time for any questions that might come up, or we'd be happy to respond to any that are passed along to us. And we could even do something like a Q&A based on whatever questions we get, either now or subsequently. Thank you very much.
Well, I'll pop in here. Thank you, Dick and Greg and Cassandra. I'd like to invite people to enter any questions or comments they may have into the chat. One of the questions, there's Tessa's question, which is my question. How do people become involved with the National Behavioral Health Extension Network? So let's start there.
I'll take a quick response to that. Apropos of it being in formative stages, we're not quite there yet, but we're getting there. We hope to, by the end of this calendar year, have a website up and running. We hope there's been some discussion about working with Connect Extension, possibly having a subgroup there. So we're basically going to create a forum for exchanges that work through the National Behavioral Health Network that's currently under development. So for getting involved, please let us know. The contact information is here, and we will follow up with you individually, and subsequently we're hoping to create a forum for broader exchanges and connections with what we're still very much developing, including the website.
Okay, thanks. Let's see if we have any other questions pop in. That was the one that came to my mind, immediately anyway. While we're waiting to see if there are any other questions that are typed into the chat box, I wanted to ask you quickly about readiness and recruiting within communities for the different prospering programs. I know sometimes that readiness isn't quite there. What does it take to become more ready? And sometimes communities don't necessarily perceive a need or want to go through the commitment on the work, because it is a significant amount of work to join a Prosper program. Can you talk a little bit about readiness and recruiting?
Yeah, that really critically important issue. I briefly mentioned it. I think I'll give Greg and Cassandra a chance to respond to that. We think about it all the time, and we're working on ways to help people get ready.
Yep, I always have to remember to unmute myself before I start talking. So yeah, the really that's a broad question, and then how to start and how to identify readiness. The first step is always just to contact us, and you can contact us through the website helpingkidsprosper.org, which is up on your screen, or you can contact me directly, and I think my email will probably be sent out, or we can send my email out. But the first thing is to identify in your state, where we're at, who wants to do this, and what resources and what readiness we have available to us. And we have a process for identifying readiness and to help you identify what's right for you and your state or your location. And then we also, as you can see, there's a variety of different things we can do. So maybe one thing isn't right for you, but another thing is. So we can help you based on where we identify your level of readiness is at and how comfortable you are. And even if, let's say, as a state or as an organization, they aren't ready to move forward with Prosper, or even, the ENET or even the resiliency training or something like that. As an individual, you can still be part of the network in the future and remain informed and things. So we'll even have a process for those folks just at the individual level to help support them. So hopefully that helps.
Yes, thank you. While we're waiting for any remaining questions, we really appreciate the feedback on the evaluation questions that are on your screen. So thank you again for contributing there. I don't see any other questions. It looks like, well, maybe we are having one more question here by Carol. Let's allow her a chance. Oh, she's just saying thank you. Maybe that's a good place to stop. We have gone for just over an hour, and I think maybe we'll end our session now. And thanks again, everyone, for joining us. Thank you, Cassandra, Greg, and Dick, for sharing all this information with us.